We've had a relationship with Boston Ballet for many, many years. In fact, probably I think almost 38 years. But in 1991, an official satellite clinic of Children's Hospital opened right at the Boston Ballet, at the newly renovated building on 19 Clarendon Street. And we provide physical therapy for the company dancers. And because I've worked so long with children with physical disabilities, and I know how difficult it is for parents to find programs for children with physical disabilities, I kept thinking it would be really nice if Boston Ballet would offer some type of a program for children with disabilities. But I knew that there was going to be two criteria that we needed for the program to be a success. We'd have to select the right children to prove that this could work, and I would have to have an absolutely fantastic instructor. Gianni DeMarco at the time was in the Corps de Ballet at Boston Ballet, and I knew Gino for many, many years, and I just knew he had the right personality and the right temperament to work with the children. He's incredibly creative and very, very enthusiastic and very, very patient, and terrific sense of humor. So when I approached Gino and I said, you know, I wanted to do this 6-week pilot program, would he consider being an instructor? He was so thrilled. He just said he could not believe that I would even ask him, because he was really, really thrilled to be able to do this. So that's how it started.
They were new to me in a way that I was educating them to something that I was so familiar with, which is dance, and trying to, you know, fuse this upon kids that I never thought I could work with was an amazing discovery for me. I've seen this progress that's been overwhelming. You know, the idea of them making dance something that's made them better people. It's the nature of what dance does to one's being, you know. I can speak loud about that because it's done it for my life. But I never knew that it had that power to reach all kinds of people and all kinds of races, and I can't say disabilities. I would say anybody is pro becoming a dancer and enriching themselves with dance. And so for me, having been introduced to this class and being able to see the development of these children has been the most overwhelming thing in my life.
In the beginning, we had a pianist, as they do in all ballet classes. You have live accompanists, and it became pretty evident that it was a little distracting. And Gino came up with the idea, you know, why don't we use a percussionist? And, you know, the drum beat, we could really get them to maybe focus and follow a little bit better with the beat. That was a brainstorm. One of the biggest challenges was all of us trying to figure out how we could teach them to learn left from right. And we tried all kinds of things. First thing, I tried ribbons on their hands, but some children with Down syndrome don't like things on their body, and so they would be pulling them off. And we tried bells on one hand. That didn't work. And then I did get the idea of duct tape on their ballet slippers. So we put red duct tape on the right and blue duct tape on the left.
When Mickey came up with the tape idea, you know, they had to put the tape on their feet, and I thought an easy task for me would be to just have a red shoe and a blue shoe. And of course, you know, sometimes I used to come in the room and I used to mistake the shoes. And sometimes it wasn't on purpose, I tell you the truth. And they used to look at me and say, there's something wrong, Mr. DeMarco. And I said, what's wrong? He goes, look at your shoes. And so they started to identify who had the wrong shoe on the wrong foot. And that started to happen with them in the class, even with their peers. They're starting to notice somebody put the wrong tape in the wrong shoe. So those were things that we started to really make us realize that what we were doing was actually working. Because once you understand that you're making mistakes, then you can fix them. And you know, me making mistakes was also a key element of learning, because I had to make this point that making a mistake was a good thing, and feeling comfortable about making a mistake was going to make him grow, and they felt very comfortable about that. And
Well, one of the biggest improvements I've seen is they've all learned left from right. We finally pulled the tape off the shoes. And that was a big event for both Gino and me, that they really know left from right. And they stop and start on cue, and they really can keep time with the music. And not only can they keep time with the music, they're creating their own moves. I mean, Gino and I sometimes are absolutely flabbergasted. He's always had them do solos. He's always had them try to do, I mean, he has a set program for them when we're in class, but then there's always time for fun and always time for them to just do creative movement. And what they come up with is really amazing.
It's opened the door for them to actually feel comfortable, to feel like I can also create, I can also be who I am and make sure and make movement of my own without feeling hesitant or maybe insecure about it. I think that aspect, that's emotionally very powerful. It's empower them to be able to do things physically, which sometimes is a very scary aspect of performing, you know, to be in front of an audience and having to create movement, and they become very fearless.
I'm so proud of their accomplishments because they are doing it. They are wonderful. We've given them we've given them the opportunity, and they have blossomed, and that's what it's all about. Children with special needs are children, and try to give them the opportunities that other children have. That's my goal.